Hey everybody, thanks so much for joining me, and we are very excited here to start our new thyroid talk session here. So I'm going to be talking about some very important information today, all about thyroid lab testing. So let me just get everything set so I can answer any questions. Feel free to post those in the comments as we chat today. Let's see. Okay. All right. So again, today we're going to be talking about thyroid lab tests. So for anybody who has thyroid disease or thinks that they may have it, and they've gone to get tested and they've gotten normal results, but you feel anything but normal and you still feel awful, please stick around. Please listen to this video. For more information, more detailed information about this, you can head over to my website at darcyproctor.com. Under my blog section, I have a whole article that outlines all of this information for you. All right, so first of all, I just want to introduce myself to those who don't know me. My name is Darcy Proctor, and I am a certified integrative health coach. And I guide and support moms who are struggling with thyroid disorders so they can feel energized, lean, and confident once again, and so they can live a vibrant, fulfilling life, right? Because we all deserve that, right? So I myself have hypothyroidism. I spent decades being undiagnosed, misdiagnosed, and mistreated. So I get it. I totally hear you. It can be such a frustrating, lonely time because you're suffering from these life-changing symptoms that your doctor's ignoring, and your friends and family, they can't see your symptoms from the outside, right? So they just don't get it as well. So I hear you. I get it. If you would ever like to sit down and talk about your personal situation, I would love to chat with you more. Just, again, go over to my website, darcyproctor.com, and right on the front page, you'll see a spot to set up a free consultation. So let's dive into these labs a little bit more specifically. So you start all of a sudden noticing that you're not feeling so great, and you just know that something is off. Perhaps you're feeling some cold intolerance, you're having excessive weight loss or weight gain, you're having some depression and or anxiety, brain fog, hair loss, extreme fatigue where no matter how much you sleep, you still wake up feeling exhausted, right? So these are all classic thyroid symptoms. So you go to your doctor and you bring these lists of symptoms to them, and hopefully they don't send you on your way and with a prescription for an antidepressant, but they actually recognize that these are thyroid symptoms, and they schedule a blood draw for you. Well, the standard care as of now is to just take a TSH test, and that stands for thyroid stimulating hormone. So anyone out there who's watching me live, give me a thumbs up or anything if this has happened to you, where you have just gotten a TSH test when you've been concerned about your thyroid. All right, so this is what happened to me. I actually wasn't even smart enough to recognize that I had all of these symptoms. I had gone to the doctor because I was having a hard time getting pregnant. So they just gave me a whole bunch of tests of all different hormones. And the TSH test came back elevated. So she put me on levothyroxine, which is just generic T4 synthetic hormone, said you'll have to be on this the rest of your life, and sent me on my way, right? So I, like many people, trusted their doctor. Okay, they know best. This is what's happening. I'll do what they say. And I didn't ask any questions for over 10 years. And then my symptoms got worse. I started doing more research, and I'm like, why have I been taking this medicine for 10 years? I've seen no improvement. I'm getting worse. And I finally started asking questions, right? So don't make my mistake. Don't wait 10 years. Get the proper test, ask questions, be your own advocate, and don't suffer for years needlessly. It's just not worth it. All right. So again, let's go back a step here to the TSH test. So again, this is the standard protocol as of now to test for thyroid. And the irony of all of this is that the TSH test does not even measure your thyroid. It actually measures the pituitary. So unless you're having a pituitary problem, this test is really kind of useless. Now, don't get me wrong, there is some method to the madness here. So what has happened is there's a feedback loop, which involves the hypothalamus, the pituitary, and the thyroid. So the pituitary is going to release thyroid, the TSH, which stimulates your thyroid to either produce more thyroid hormone or less thyroid hormone. So it does make sense in the circles of things in the feedback loop. But it doesn't, again, actually measure what's coming out of the thyroid gland itself. Now, in regards to the results of a TSH, it's a little counterintuitive. So just be aware that if your result comes back as a high TSH, that actually means that your thyroid is underproducing. So that's hypothyroid. And if your TSH is low and close to zero, that is hyperthyroid, where your thyroid is producing too much thyroid hormone. Okay, so they have very different symptoms. One, the hypo being everything's very slow and sluggish. All of your symptoms are going slow. Where the hyper, right? So think, too much thyroid hormone getting you hyper. Think, weight loss, very jittery. Everything is moving at a much faster pace. So that's kind of the big difference between the two. Okay, so again, so that's TSH, not measuring thyroid itself. So what we really want to look at, if we want to look at the function of our thyroid, is the thyroid gland itself and what it produces. And it produces 4 different hormones called T1, T2, T3, and T4. So the main ones that we want to look at are T3 and T4. T4 is your inactive, your storage hormone. And T3 is your active hormone. So the active one is what's fueling your cells, giving you the energy, starting the metabolic processes. So these are both very important to see what your levels are, because the T4 is your storage. You need to have enough of that, but it needs to then get converted into T3, which binds to all the cells. We have receptors in every cell in our body for thyroid, and that's what the gas that gets your cells going, gives them energy. So you need to have the proper amount of both. So again, why are doctors not measuring these two thyroid hormones from the thyroid gland? Because if we have a problem in this whole cycle, right, then we're missing something here and we're not treating it properly. So one point to note about this is that there are actually 2 tests for each of those thyroid hormones. There's a total and a free. So what we really want to look at is the free version. So the free T3 and the free T4. Please make sure you make a point to ask these specifically for your doctor, because they will often just do a total T3 or a total T4. And those are fine. The more information, the better. But if we're just narrowing it down to the most essential lab test that you want the free T3 and the free T4. And what that means is that is measuring the unbound hormone that is floating through your system. So the ones that are not tied up in the receptors and bound in your system, versus the total, which is just everything in your system. Okay? Everybody with me on this? I know, it can get a little confusing. Let me know if you have any questions. I'm not even really sure how to find the comments here, but yeah, here we go. Okay. So any comments and questions, just feel to pop those into the chat box, the comment box down below. All right, so to make things more complicated, I'm going to add in another test for you, and that's called the reverse T3. So the T4 makes T3 and reverse T3. And the reverse T3 is kind of like the brakes on the system. So what the reverse T3 does will bind to the same receptors as the T3. So if you end up with an elevated reverse T3 number, that means that there's too much cycling through the system. And what that means then is that there's not enough room for not enough receptors for the T3 to bind to, because the reverse T3 is blocking it. Now, again, in this beautiful balanced system, you would be making just enough of everything to keep it all running smoothly and flowing fine. But if your numbers all of a sudden start shooting out of range for some reason, there's a problem somewhere in that cycle that you have to dig down and figure out what's going on with that. So an elevated RT3 is going to give you similar either hypo or hyper symptoms as well. So that's another thing to pay attention to. Now, this test can be a little bit controversial between doctors. Some don't see any point to it at all, and some think that it's essential. So I will leave this one up to you, but definitely get your free T3 and free T4 tested. And if things seem really out of whack with that, then you may want to also ask for the reverse T3, just to get the whole picture. All right, so now we have all of these tests and all of these results. So what do they mean? Okay, so if you go to my article, again, it's at darcyproctor.com/lab-tests, you'll see a nice graphic on there that discusses these 6 essential tests and the optimal ranges. And what I mean by optimal ranges are these are the ranges that doctors have figured out where patients feel their best. Okay, so they're called functional optimal ranges. So they've been made up, or not made up, they've been devised from the functional medicine community. And you'll notice that they are much tighter than the lab ranges. So every lab that is out there that you go to get your blood draw will have their own ranges for each test. But the optimal functional range is a lot tighter. So that's the number that you want to kind of aim for. So the TSH is what we would look for, would be 1 to 2. Free T4, 1.2 to 1.4. The free T3 will be 3.2 to 4.4. And then the reverse T3, you want those numbers to be low, but a better range to look at is actually the ratio of free T3 to reverse T3. And in that range, you want it to be 20 to 30. So again, these are all just guidelines to go by, but if you're been told that your labs are normal and you notice that they do not fall in these optimal ranges, that could be a reason why. So you need to make some adjustments to try to, narrow it down to get them into these ranges. The last thing on the list that you'll notice are antibody tests. And why this isn't run just naturally is beyond me, but you really want the TPO and the TG antibody test run. And what this will tell you is if you are having an immune attack on your thyroid, which would mean that you have an autoimmune component to your thyroid disease. So TPO is usually the main one that people see antibodies for, but TG is also another one. So, best to have them both run, but if you can only pick one, go with the TPO. And you want this number to be less than 4, if not negative. The problem gets is that, unfortunately, lab ranges nowadays are giving you a less than number, and that threshold is actually kind of high, like about a 32, I think was the last one that I just had. So essentially, though, if you have any antibodies, your body is making an immune response. So, maybe I had 31, but my result now is going to say it's negative, or because it was less than the 32, but I actually really did have antibodies, right? So unfortunately, that's how the tests, most of them are right now. But depending on your lab, they might have different results. So the goal that you're reaching for, though, is to have no antibodies, and this will rule out autoimmunity. This, unfortunately, though, sometimes they show up at different times. In this sense, actually, it's helpful because antibodies will show up, they can show up even 10 years before a TSH test will be out of range. So if you are feeling that something is off and that you have a thyroid problem and your numbers keep coming back normal, make sure you're getting this antibody test, because perhaps you already have an autoimmune disease, which would be either Hashimoto's, which is the hypothyroid causing hypothyroid, or Graves' disease, which is hyperthyroid. So, your body is already attacking itself, yet your TSH is not demonstrating that yet. So you don't want to wait years while your body is destroying your thyroid before your doctor says, oh, let's do something about it because your TSH is out of whack, right? We need to know these things now. Unfortunately, these tests are not done preventatively. It's now, they're done to measure the function after things are already heading downhill. Okay, so the more you can get on top of these things earlier, the better. Okay, so those are the 6 main essential tests that I would recommend. Again, TSH, free T4, free T3, reverse T3, and then the TPO and AG antibodies. One other thing I'm going to mention, and I think it's also in the article, is that if you are showing no antibodies but are still concerned about your symptoms, you can also get an ultrasound. And this is a more definitive diagnosis where you're going to test for the tissue, see if there are any changes in your tissue, perhaps it's shrinking or enlarging, and I'll also notice if you have any nodules. Now, don't get scared if you do show some nodules, because the majority of them are benign, but it's something you want to be aware of so you can stay on top of it. You absolutely can shrink the nodules. So there are things to do, but again, it's about getting the whole picture and knowing what you're dealing with so you know how to, heal and start to treat yourself. The other thing I want to point out is that these numbers and all are just guidelines, right? As I said, it is a huge flowing system. Our body always is trying to stay in balance, but there's a lot of pieces to this puzzle, and you may have to do a lot of digging to find out where something might be off. So I want you to really focus on your symptoms. Thyroid can be kind of confusing because it mimics a lot of other problems that could be going on. The symptoms are similar, but if you really peel back the layers, you can see that everything kind of all ties together and they're all interrelated. So, if you are getting these lab tests back, but you still don't feel well, things aren't adding up, still be your own advocate. You're going to have to dig deeper. There's a lot more to look at. There could be nutritional deficiencies. There could be infections. There's lots more to uncover. You would need obviously a qualified functional medicine or a trusted physician to help you uncover all of these things. But pay attention to the symptoms because they are going to guide you. Don't just follow numbers. These are all just guidelines. I also want to point out the proper way to take the blood test, because a lot of supplements, particularly iron and biotin, will change your thyroid results. So it's best to not take any of these supplements for maybe about 2 weeks before your blood draw. And if you're taking any thyroid medication, do not take that the morning of your blood draw as well. Wait till after your test and then take your thyroid medication. Any questions? Anything coming up so far? Okay. All right. So I'm going to leave the link to the blog post in the comments below. But again, it's darcyproctor.com/lab-test. Please feel free to go in there, read this information in more detail, print out that graphic that I mentioned that lists the 6 essential tests as well as their optimal ranges. Bring them to your doctor. Have an open conversation. If they're not willing to work with you, you may need to find someone else. Let me tell you, I can't even count the amount of doctors I've gone through so I can find the right support team that, helped me in my personal situation, dig down and get all the answers. So it may not be easy, so you're going to have to fight for it. But you can also, if you have pushback from your doctors, you can also order these tests online yourself. Some of the lab tests online are Ulta Labs or Direct Labs, and I have the links for those in the article as well if you're looking for that. So, if you're running into problems with your doctor running them and you want to know these answers, you can order the test yourself. You can also call your insurance company ahead of time, and they may reimburse you for those tests as well. So that's a win-win. But again, of course, I am not a doctor. I cannot help you with the results. So it's best to find a qualified functional doctor, integrative doctor. Chiropractors are also trained in nutrition. So these are all fields of medicine that they are aware of the current standards for thyroid and the thyroid testing and treatment. So that might be a good place to look further into. But ultimately, if you really truly want to heal from your thyroid condition, the only way to get rid of these symptoms is to find your root cause. As I mentioned before, these could be a whole bunch of different things, perhaps low iron or iodine, an infection, stressful trauma. There are nutrition deficiencies. I mean, there's lots of different things, and it takes some work to uncover these things, but it is so well worth the journey to find the root cause, because once you figure that out, you can heal all of those steps of the ladder and your symptoms can be gone. Perhaps you could be off medication, whatever your goal may be. I guarantee that there are ways to get through this and you don't have to just be thrown a medication for the rest of your life. And that doesn't have to be the way it is. So again, if you're looking for any support, I'm happy to help. Just set up a free consultation on my website. Check out my blog. Keep an eye on that, because next week I will be talking more about root causes and some of the main ones and what you can do to uncover your individual root cause. So that'll be up on my blog. Go ahead onto my website and put your email in there and get on my list. So I will also be sure to let you know when any new articles come out. But if you're also looking for some peer support, like I said, it can be very lonely place having thyroid disorder. I started a support group on Facebook called Healthy Thyroid Over 40, and we're having a lot of fun in the group, sharing ideas, recipes, doing fun challenges. They've got prizes in there. So feel free to head over to Healthy Thyroid Over 40 on Facebook and join that group as well. But I hope this information was valuable and important, and everyone found it informative. Again, if you have any questions, please feel free to reach out to me. I know it was a lot of information I threw at you and it could be confusing, but just let me know if any questions come up. All right, have a great day, and I'll talk to you all soon. Take care.